Hello and welcome to Ruplin's Diary. This is Ruplin and I'll be showing you how to inject insulin. It is really important to get proper dose of insulin, and also it is important to store insulin properly. You'll have to store insulin in a refrigerator between 2 to 8 degrees Celsius after injecting, and before injection you'll have to take out the insulin bottle out of the refrigerator and bring it to room temperature. For injection, you'll of course need an insulin, and here I'm using human ectropic clear soluble insulin, and this is not a new one. I've been using it since 2 days, so there is no plastic cap on the top. And secondly, you'll need a syringe, and thirdly, you will need two alcohol swabs. First of all, clean the top of an insulin bottle with an alcohol swab. Take out the cap of the needle, draw in air equivalent to the amount of insulin that you'll be injecting. Here, I'll be using 12 units of insulin. And while placing the insulin bottle in an upright position, inject the air. With the needle still inside the insulin bottle, turn the insulin bottle and draw in the amount of insulin that you require. Make sure there are no air bubbles inside. There are different sites for insulin injection, but here I'm going to show you how to inject on the abdomen. The commonest site is the abdomen, and that is 3 fingers away from umbilicus. Clean the site for injection with an alcohol swab and let it dry. Now pinch up the fat tissue with your fingers to avoid intramuscular injection. Usually the thumb and the index fingers are used. Now inject all the insulin slowly at 90-degree angle and count up to 5 seconds. Do not pull out immediately or it may lead to expulsion and you'll not get the required dose. That's it! Place an alcohol swab but do not rub the area. And always change the site for injection. Like I have injected here now, and I'll be injecting the other side next. So this is how to inject the insulin, but always follow your doctor's instructions.